vitamin D is easy to be tested with a blood test, and just ask your healthcare provider to do that. It's a vitamin D 25-hydroxy level. What I've been trained is that we want levels to average between 55 to 80 to be at optimal, because there's so many areas in the body that need vitamin D. There was a study that supported that if people had an average vitamin D level of 51, it would decrease breast cancer by 83%. And there was another study that supported it would decrease all cancers by 40%. So vitamin D is actually also being used to treat some cancers in high doses. So the other thing with vitamin D we hear about it is osteoporosis, and that's what's got the attention while so many doctors test for vitamin D, and they're treating it now, which is great. But make sure that we get treated and stay treated, because the level is so important. In mood and depression, I see a lot of depressed people, and then when I find a low vitamin D and treating them with vitamin D is real inexpensive to do. I've seen a lot of people with depression improve dramatically, and it happens on a weekly basis. I had one lady, like with skin, that had terrible acne problem, that her with vitamin D, she knows it cured her skin problem, which she had seen many specialists and been treated with for years. So vitamin D is good for the brain, it's good for the bones, it's good for the skin, it's good for the, even heart. There's studies that support that. But low vitamin D can cause a lot of disease. One thing that people tell me that they are out in the sun a lot and they don't need their vitamin D tested. And there was one speaker that specializes in vitamin D that says if a person's out like in the Bahamas all day in the sun, they can earn 25,000 units, which is made on the skin as the sun combines the skin, has a reaction. But it takes a lot of times 6 hours for that reaction to occur and to be absorbed in the skin. So if you go and wash it or take a shower, then it's washed off anyway. Also, if you use sun tanning lotion, then you don't get the appropriate level of vitamin D. And then in our foods, I think in processing our foods and things, green leafy vegetables are our number one things that have vitamin D in it, but the milk and other things do not have enough vitamin D to really supplement what we need. One of the things that's important for me then is because of fighting cancer, helping bone, helping the skin, helping osteoporosis, that it's real important to follow your vitamin D level. To supplement, it's real inexpensive, and to supplement and to remain on a high level to prevent disease.